Hello and welcome. Now, the World Health Organization has officially named the novel coronavirus pneumonia as COVID-19. Earlier today, China reported 2,048 new confirmed cases of novel coronavirus infection. In India alone, many suspected cases continue to remain in quarantine and under observation. Here's the global report.
On December 31, 2019, the World Health Organization was alerted by Chinese authorities to a number of pneumonia-like cases in the city of Wuhan, the capital of China's Hubei province. Since then, over 1,700 people have died of the disease in mainland China alone. But now, China's National Health Commission reports a continuous decline in new cases outside the epidemic epicenter of Hubei province. A delegation of experts from the World Health Organization are also slated to visit Beijing and the provinces of Guangdong and Sichuan to conduct on-site investigations.
China has a strong public health and health system, demonstrated. China has a strong scientific and discovery system. China has the capacity to develop and scale up vaccine production. So we need to work with China.
On Monday, Beijing citizens slowly trickled back to work. China had imposed a 14-day self-quarantine on all those returning to the capital. It was the latest effort to contain the spread of novel coronavirus.
那我因为家住的不远，就是到公司也比较方便。 而且我想，既然大家都没有去公司，应该说公司也是非常安全的。我看到那电梯都是每2个小时就消毒一次，而且进这个大楼要量一次体温，要登记，然后进公司又要再量一次体温，所以我觉得那种恐惧其实是没有必要的。
After an extended Lunar New Year holiday, many Chinese cities remain in lockdown with deserted streets, closed restaurants, and travel bans in place across the country. China released statistics that showed its quarantine and treatment efforts were helping control and prevent the epidemic from spreading further. Around the world, the death toll from novel coronavirus has risen globally. Over 71,000 have been infected by the virus. Meanwhile, 2 more Indians on board a quarantined cruise ship have tested positive for the novel coronavirus. The Diamond Princess docked off the coast of Japan's Yokohama now have a total of 5 Indians who've tested positive for the deadly virus. With around 356 confirmed cases of coronavirus on board, 70 of which were announced on Sunday, the ship has the largest concentration of novel coronavirus cases outside mainland China. With about 133 Indians still stranded on board, India has assured that it will provide all possible assistance to its nationals to return home after they test negative in the final coronavirus tests. On the other hand, US citizens on the quarantine ship were airlifted out of Japan today. There were 400 Americans on board, out of which around 40 US citizens tested positive for the virus and are being treated in Japan. Australia too has announced a plan to evacuate more than 200 of its citizens on board the coronavirus-stricken cruise ship. The novel coronavirus is one of the most contagious and deadly of similar epidemics. The number of confirmed afflicted cases and deaths related to the new virus has dwarfed those associated with the outbreak of SARS, a related virus that spread from China in 2003.
Well, while the world fights the outbreak of the epidemic called coronavirus, there are stories emerging of patients being discharged after treatment in China. And this has been possible because of tireless efforts of medical practitioners in China. Here's a report of how China is slowly but steadily being able to fight COVID-19 coronavirus.
There are stories of corona survivors emerging day by day in China. Close to 1,500 patients were discharged till 16 February evening after recovery from the COVID-19 virus across different provinces in China.
医护人员然后近距离接触，还是能亲切地感受到他们的特别辛苦，然后不容易，特别真诚地感谢他们。这个病毒它并不可怕，完全可以战胜。
In southwest China's Wizhou province, a 2-month-old baby who was only 55 days old when she was admitted to the hospital was released together with her mother. The baby was infected with the virus on January 25 when she and her parents returned home from a trip to Wuhan in Hubei province, the epicenter of the epidemic outbreak. This has become possible for the non-stop back-breaking dedication of the nursing staff engaged in this uphill battle against the virus outbreak.
当时支援的人还没有到，然后我们体力都处于一种透支状态。我管了3个病人，当时情况也不是很好，病人情况不是很好。然后呢，我又处于生理期，肚子有点疼，然后背了那个送泵系统10来斤，然后又忙，就病人要抢救，然后就顾不了自己了。
Families of medical practitioners engaged in this fight against the outbreak have been coping with it in novel ways. Tianyan had to stay home all day, and most of the time his grandparents are his only companions. His father works at the city's disease control department, while his mother is a nurse who joined the battle against the virus after the Spring Festival.
之前没网课的时候就特别无聊啊。
那每天做什么呢？
每天就跟爷爷下一下象棋，然后有时候就躺在床上睡一下觉。
一天能睡多少？
一天睡个10几个小时没问题啊。
His septuagenarian grandparents are also trying to adjust to this new lifestyle.
这个我是按时的弄饭那些，是吧？这我现在全国人民都。 支持我们武汉，是要为武汉加油，为湖北加油，为中国加油。
In India, the state which has the maximum number of people under the radar of coronavirus infection is Kerala. The state has taken every precaution to contain the deadly outbreak. The government has vowed to be virus-free by March. Here's the full report.
Kerala has managed to arrest the spread of coronavirus. The latest sign of improvement is the number of people in home quarantine, dropping significantly to 2,288. Those who are in isolation are eager to step out, but they do realize this is a global public health emergency.
How long have you been in isolation at home?
It is more than 18 days now.
Okay.
I think 18 days.
Without any symptoms?
Without any symptoms. I have no symptoms.
Has there been any strict vigilance from the government?
We get calls from the department.
Health officers.
Health department.
Right. Will you go back to China?
Yes, of course, I'll go back to China once everything is settled. At present, I'm not so much worried about these things. And my kid is in a school also, he's in LKG. And for him, the online schooling will start from tomorrow.
Ensuring people in home isolation don't step out can be a task. Kerala has deployed 40,000 public health workers to reach out to these families in most sensitive way.
To ensure better surveillance of those in home isolation, the Kerala government have deployed primary health workers here who are also called ASHA workers to aid in whatever basic necessities these aggrieved families need, including essentials, daily essentials that they deliver to their doorstep, and also to the extent of taking care of their pets, domestic animals that these ASHA workers are taking care of. They are seamless communal government.
നമ്മൾ ആദ്യം അവരുടെ വീട്ടിൽ ചെന്നിട്ട് ഒരു മീറ്റർ അകലെ നിന്നാണ് അവരോട് സംസാരിക്കുന്നത് പോലും അവരെ പുറത്തിറങ്ങാതെയും അവർക്ക് വേണ്ടുന്ന ഭക്ഷണങ്ങൾ നമ്മൾ തന്നെ നേരത്തെ ആ സമയത്തോടെ എത്തിക്കുകയാണ്. ഒരു മാസത്തെ ഫുഡ് നമ്മൾ ഫുഡ് കിറ്റായിട്ടോടെ കൊണ്ട് കൊടുക്കുകയായിരുന്നു. കാരണം പുറത്ത് പോകാൻ പറ്റാത്തൊരു സാഹചര്യമാണ്.
അയാൾ ഉപയോഗിക്കുന്ന ടവലോ സാധനങ്ങളോ ടോയ്ലറ്റ് വരെ പ്രത്യേകമാണ്. അത് മറ്റൊരാൾ യൂസ് ചെയ്യാൻ പാടില്ല.
The ASHAs were trained through the system, which generally they are medically, they have a health training. On top of that, we train them in the nitty-gritty of corona so that they could give specific advice to the family. ASHAs were a sort of frontline linkage between the very high-tech health department and the general public in a very friendly manner.
Not leaving anything to chance, the state's rapid response forces are present in each district, ensuring sharp surveillance, but in the most sensitive manner.
Kerala's top-down approach in tackling the public health crisis is certainly what other states need to emulate. In Kerala, the number of people who are in home isolation have come down to half, which means the situation is indeed improving. And Kerala assures that by early March, Kerala will be free of coronavirus. This is Nabila signing off with camera person Shakil for India Today, Kerala.
Now, the symptoms of a coronavirus infection depends on the type of infectant, but common signs include respiratory symptoms, fever, cough, shortness of breath, breathing difficulties. The World Health Organization also says severe cases of infection can cause pneumonia and can be fatal. Now, the International Monetary Fund on Sunday said that the coronavirus epidemic could damage global economic growth this year. Here are some quick facts about the 2019 novel coronavirus. 2019 was a previously unidentified form of coronavirus. Initial symptoms included fever, cough, breathing difficulties. There is no vaccine or antiviral treatment currently available to treat coronavirus. Patients with symptoms should receive supportive care to relieve symptoms. For technical queries, call the official coronavirus helpline number. The government has also issued advisory requesting people to refrain from traveling to China. Along with the spread of coronavirus, few conspiracy theories are also taking its flight across social media spectrum. How and from where did the virus spread or originate is yet to be ascertained. Here's a report by India Today Anti-Fake News War Room that scanned 3 of these viral conspiracy theories to test. Take a look at their findings.
A lot of conspiracy theories are doing rounds on social media as to how this virus really emanated, where did it really emanate from. But the fact of the matter is that is still to be ascertained. What we did here was, at India Today's Anti-Fake News War Room, take a stock of all these conspiracy theories, analyze them, and analyze how much of these theories could be the real threat. The Wuhan Institute of Virology is at the center of this first theory that we're talking about. In fact, an Israeli biological warfare analyst is the one who claimed that deadly animal-borne coronavirus may have originated in a laboratory in the city of Wuhan linked to China's covert biological weapons program. That is conspiracy theory number 1. Dr. Danny Shoham, a former Israeli military intelligence officer who has studied Chinese biological warfare, has said this to the Washington Times, and I quote, "Certain laboratories in the institute have probably been engaged in terms of research and development in Chinese biological weapons, at least collaterally, yet not as a principal facility of the Chinese BW alignment," unquote. You might wonder where this conspiracy theory really originates from. The Wuhan Institute of Virology that we were speaking about has done a lot of research in the areas of Japanese encephalitis, on SARS, H5N1, influenza virus, and dengue as well. Indicating that the virus might have leaked out of the laboratory, Dr. Shoham said that though Wuhan Institute of Virology comes under the Chinese Academy of Sciences, but certain laboratories within it have linkage with the PLA or BW-related elements within the Chinese defense establishment. The US State Department has alleged earlier that China maintained a small-scale offensive biological weapons program even after joining the Biological and Toxins Weapon Convention, BTWC, and that the Chinese entities have transferred controlled biological weapons-related items to nations of proliferation concern such as Iran. BBC News has reported that the claim about the covert Chinese biological warfare program is baseless. It is said that former Israeli military intelligence officer, whose quotes have been used in the Washington Times article, has failed to provide any concrete evidence to substantiate it. We here at India Today reached out to the author of this particular theory, Dr. Danny Shoham, to ask him if there was any kind of substantial evidence which is backing this particular theory as published in the Washington Times. He responded on email saying, and I quote, "I was asked and talked about the possibility of accidental virus leakage and not about covert Chinese plot in biological warfare," unquote. We spoke to Rajiv Nayan, a senior research associate, IDSA, who has expertise on weapons of mass destruction, and told India Today, and I quote, "I cannot say whether the claim made on coronavirus and covert Chinese BW program is true or not, but the threat of covert biological warfare amongst the nations is real," unquote. According to him, any biological or chemical agent can be developed by any of these countries, and there are just no restrictions to it because they develop this under the guise of research and development, or R&D. In July last year, a report was published by CBC.ca that revealed that Dr. Kui, her husband Kering Cheng, and an unknown member of her student from China were removed from Canada's only level 4 lab on 5th of July. And many people on social media have come up with their own explanation for this. They tried to connect these dots and say that there were 2 Chinese spies who ended up stealing this particular virus and brought it to the Wuhan lab, and that's how this entire coronavirus outbreak really took place. It is believed to be a theory floated by a businessman, Kylie Bass. Another report published on 3rd October 2019 by CBC News revealed that they obtained travel documents of a Canadian scientist at the National Microbiology Lab in Winnipeg who made at least 5 trips to China, including one to train scientists and technicians at China's newly certified Level 4 lab. On January 28, 2020, NTD TV, one of the largest Chinese news networks, also reported this. According to them, coronavirus was reported to have arrived at the National Microbiology Laboratory in Canada from a Dutch laboratory on 4th May 2030. They went on to write that after investigation, the mysterious incident can be traced back to a Chinese spy working at the Canadian National Microbiology Laboratory. In their report, they mention an article by an online portal. The Week 2 reported based on the article by an online portal. You might wonder where this theory now originates from. On 27th of January as of this year, the CBC.ca ended up publishing another report to claim that the previous report is being misinterpreted. According to them, the Public Health Agency of Canada denied any connection between the removal of the scientist last summer and the existing coronavirus outbreak. But another article by PolitiFact debunked their theory. Hence, there is no proof that this particular potential spy theory which is making rounds has got any connection whatsoever to the coronavirus outbreak. Now, there's a very interesting third theory that is making rounds as well. Many on social media have come up with these bizarre claims that the patent for coronavirus was applied in the year 2015 and was granted in the year 2018 to Pilbright Institution in United Kingdom, whose founders happen to be Melinda and Bill Gates. This theory was originally floated by conspiracy theorist and YouTuber Jordan Sather, who tweeted this in a lengthy thread. There is no substantial proof that Pilbright Institution is the one that is responsible for the coronavirus outbreak. No mainstream media has even reported this particular story. Several international fact-checkers have debunked this theory. They have found that the patent application for coronavirus was made in 2015 for one type of coronavirus, but not the particular Wuhan type, which is called the Wuhan coronavirus. As per this article, the Pilbright Institution did not receive any funding for this particular patent work from Bill and Melinda Gates Foundation, and the institute was also not founded by them. So we here at India Today's Anti-Fake News War Room brought to you the 3 top stories that are making rounds on social media and really where they stand, where each one of them really stands as far as the coronavirus outbreak is concerned. Remember, this is one of the most talked about topics in the current sphere, given the fact that how the entire world is now slowly getting affected by the coronavirus. In fact, there are many more social media theories that are doing round, many news organizations reporting different theories as to where this virus really emanated from. But for now, we're still waiting for further information to come out from the Chinese government.
Now, there's a lot of misinformation also doing the rounds in the social media regarding coronavirus. One of them is an advisory allegedly by the Health Ministry. India Today Anti-Fake News War Room went through this viral information and found it to be false.
A post that claims to be an advisory from Union Health Ministry is viral on WhatsApp and was put on Facebook as well. It warns, keep your throat moist, do not let your throat dry up. Once your membrane in your throat is dried, the virus will invade your body within 10 minutes. It also advises against eating fried and spicy food. The truth? The Union Health Ministry has issued an advisory, but it isn't the one being forwarded on WhatsApp. The actual one is this. It lists precautions but doesn't mention any of the measures suggested in the viral message. Bureau Report, India Today.
All right, with that, it's a wrap on this edition of In Depth. Do stay tuned.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.